Computer. Hey, Cherry Creek kids. I have Nicole Parsons who's going to talk to you about what she does. Nicole, thanks so much.
Hi, so thank you for that. I am a nurse with AirLife Denver. I am a registered nurse. I also have a master's degree in nursing education and a certification in critical care. Within AirLife, I function as a cardiac assist team and one of the base leads that just kind of oversees one of the bases that we have. So what does a Colorado flight nurse do? So we transport critically ill, injured patients within the Colorado and surrounding areas. So for instance, right now I'm at a base in Holyoke, Colorado. And from here we serve some of the smaller communities such as Hospital Melissa Memorial in Holyoke. We also fly out to Nebraska and some of these underserving areas that don't have the big hospitals that Denver has. And we fly to those hospitals, or we meet EMS directly on the side of the highway or at the backyard of someone's house in a remote area, and fly them into Denver that can provide them with neurological services, trauma services, surgical services, things like that that aren't available in their area. And we do this via helicopter. We also have fixed wing, which is a fancy way of saying airplane, and we have ambulances. So if the weather's bad, we can jump on an ambulance and make the call. I've also taken a helicopter to a plane, flown the plane into Denver, gotten back on a helicopter, flown that into the city, and then taken an ambulance back to my base. So sometimes we need all of those methods to get where we need to go. And we take these patients usually to an emergency room or an ICU. Sometimes we take them directly into the OR as well, or into like interventional radiology services for strokes. So why did I want to become a flight nurse? So I started working at Duke University Hospital in North Carolina in the cardiac ICU. And our flight nurses would come in and they were just heroes, and they had so much autonomy in what they could do. And so I just couldn't imagine not doing anything else. And so I set my sights to become a flight nurse, which we'll talk about a little bit here in a minute, what that takes to become. But being a flight nurse is a way that you can have autonomy in nursing without having an advanced practice degree. We do things that physicians do. We do things that respiratory therapists do, and things that a normal bedside nurse is not trained to do. Maybe you guys will recognize this. So the office view is pretty cool. That's the Red Rocks Amphitheater. So as I was kind of saying before, we have 5 helicopters, 2 fixed-wing aircraft, and 2 critical care ambulances, part of our team, which are based all in the surrounding areas of Denver. We have some in Cheyenne, Wyoming, one at Skyridge, Firestone, which is out towards 25, going out towards Cheyenne, Wyoming, Holyoke, and Hugo, Colorado. The teams that we have as primary team, which I'm a part of, which means we take care of babies that are 1 month old and up. And so we do kids, babies, adults, geriatrics, you name it. But we also have a high-risk OB team, which specializes for pregnant women, high-risk pregnancies. The same thing, you're in this little town and your pregnancy isn't going very well. You need to be brought into Denver to be managed for that. And in case you don't quite make it, we also have a neonatal team that can respond to that pregnant woman and take care of her there. They do newborns and preemies. They're a whole specialized team, and they're amazing women. I'm sorry, I shouldn't say women. They are amazing people. We have men on our team as well. And then we also have the cardiac assist team, which I'm a part of. So we do ECMO, which is the artificial heart and lung. We do all kinds of cardiac devices, the LVAS, which is an artificial heart. We do balloon pumps. I don't know if you guys know what this stuff is, but, and let's see, balloon pumps. We also have another device called an Impella device. So all these like fancy cardiac equipment that gets put in, we manage that and find a way to transport all this equipment into the hospital system that it needs to be in. Pretty cool. So we kind of talked about this before, where our helicopters are, and our fixed wings are at the Centennial Airport. For our team, so it takes a whole team of people to have us operate. So we have doctors that we can call anytime, anywhere, on scene, in the heat of the moment, and say, this is what I'm thinking right now, but I'm not sure that this is the right thing to do, or I am at a loss right now, and this is the patient that I have. And you give them a quick rundown, and they help you through the call if you truly need that. We also have communication specialists, which are like 911 operators that are just for us. We have nurses and paramedics on our team. We have EMTs that help us in the ambulance. Of course, pilots. So we have pilots for the helicopters and for the airplanes, which we have 2 pilots each for the airplanes. The mechanics that take such amazing care of us, that we trust to get in that helicopter every time and know that they have fixed whatever issue it was, or they've done the maintenance on it. We also have administration and billing team that keeps it all running smoothing in the background. So big team, a lot of people. So how to become a flight nurse? So, well, one, you got to become a nurse. So you can do that with an associate's degree or bachelor's degree. And from there, each program's a little bit different. Some are 3 years. We're a 5-year experience. So you have to work in an ICU or ER or both. And this can be in peds and adult for about 5 years to have that experience. So you can't just come out as a new grad and be a flight nurse. The other thing is that it's required that you have a lot of different certifications. And again, this varies depending on what program you are, but we have to be certified, of course, in all the advanced life supports, including PALS, which is peds, and for neonates for the babies. Some places require that you have certifications in trauma as well. And in North Carolina, we also had to be an EMT to function out of the hospital as well as within the hospital. We also all carry an advanced certification. So as I said earlier, mine is CCRN, which is a critical care registered nurse. But there are a few other different variations of that, depending on what your specialty is. Pardon me. So you became a nurse. You've got your sight sets on being a flight nurse. You've done your 5 years. You've gotten all your certifications in the background, and you come and you do the interview. So the interviews and the selection process is a very selective and grueling process. Usually the interviews are several days long, or meeting with several teams. You run scenarios. You sometimes shadow along with the team, because sometimes you think that this is what you want to do, but maybe you get kind of sick in the aircraft, or you had a fear of heights that you didn't really realize that you had. Another very important part about our job is staying very calm and collected. So we may walk into a room and it's chaos, and everyone's working very hard, but they're freaked out and they don't know what's happening. They look to us to come into that room and be that calming presence, and to say, okay, this is, let's help, let's work together, let's do the best thing for this patient. So sometimes you just kind of got to get in there and figure out if this is the right thing to do. And so that's why our interview process is so very grueling, to make sure that it's a right fit for everybody. We also have paramedics, and so the same thing, the paramedic career path is you would start as an EMT and you would get your paramedic. They also have to carry the same advanced certifications that we do. And for our team, they have to have previous flight experience, which can be a little tricky to get, but maybe they can start in not such a big city or something like that, and just kind of get their feet wet and get some of that background experience, and then they can come and work for us. So we talked a little bit about this, but so it's a humbling job, in that if you have gotten in over your head, it is very important to know what your resources are to make that phone call to the medical director, to look at your partner or to look at your resources and say, I'm not really sure right now, but let's figure this out, find a solution to it. And we have to be very safety conscious, not just our own safety, but watching everyone around you, making sure no one's approaching the helicopter when they're not supposed to, making sure that if you've landed on the side of the highway, that you've put someone like a firefighter or a police officer in charge to watch the tail of the aircraft to make sure people aren't going to drive their cars into it or walk into it because they're curious. And in this day and age, we're always on camera. I assume that someone always has their phone out and they're watching us. So being safe around and showing what that process is like and being courteous and also being calm is very important. We also have to be in good fitness health. This job is demanding. We carry large bags with us. We carry, the patients on these stretchers and flats, and we're doing a lot of lifting. And we're doing this in a very confined area. So being healthy and stretching are all very important things. This job also, we work 12 to 48-hour shifts. For the most part, we average working a 24-hour shift. So kind of like firefighters do, where they come in and we have the whole teams together, myself, either my nurse paramedic partner and the pilot, we all stay together in a house or apartment or something like that. Like one of our bases is above a fire station. Where we're at today is like a little offset right in front of a hospital, so different settings. And we have the ability to cook dinners. We have the ability to rest when we need to. But with that in mind, in 24 hours, you can also have multiple calls. So being well rested mentally and physically is very important for this job. Keeping your head in the game. So whatever might be going on outside when you get that call is getting into that zone and making sure that you're safe in the helicopter, number one and first and foremost. Two, that you're doing the right thing for that patient. So you're taking these patients from the side of the highway or outside of a hospital environment, and you don't have the resources that they have in a hospital. I mean, yeah, I can make a phone call, but I don't have someone extra to do CPR for me. I don't have someone to do an x-ray or do lab work or have this information necessarily at hand. So really being on top of your game and using your assessment skills and just doing the right thing for the patient is very important. We talked about being calm during stressful situations. And then the ability to make a difficult decision. Sometimes maybe the best thing isn't to take that patient out of the hospital, away from their family, away from their loved ones, and send them an hour into town. Maybe at that moment, that's not the right thing to do. So coming to talk with the families and making the best decision for everyone. So. Real fast, when you are selected to be a flight nurse or paramedic, our orientation is about a 5 to 6 month program, which involves classroom, didactics, clinicals. We run scenarios. They're pass-fail scenarios that you work together with your partner, and you're evaluated on those, not punitive, but just so that we can all learn and grow. Everything we do is so that we can be better and learn from I hate to call them mistakes, but things that we could have done better or differently. We have simulation labs that we also have access to. Some of the very heavy equipment that we carry around with us. So anything that they can do in an ICU or an ER, we amazingly enough can do in that tiny helicopter. So if you need to be intubated, which is the breathe-in tube, we can do that and put you on a ventilator. If you need a chest tube, so your lung has collapsed or something like that, we can take a scalpel and go in there and open that lung back up for you, right there in the helicopter or on the side of the road, wherever that needs to be done at. We can also do the movies, they do the defibrillator pads. We can do that. We just put pads on it. We don't do it quite like the movies, but we can do that for you. We also have, the pumps that run the medications in. We can get blood. One of our helicopters does carry blood on it, or we can take some from the hospital if we need to. And then these are warmers, so it can get so cold in Colorado that in the amount of time that you've left the hospital and you're trying to load in the helicopter, that the medication that we're trying to run into you can actually freeze. So there are a lot of challenges to this job and working in the elements that people don't necessarily think of. So we recently got these warmers that hopefully will help our lines from freezing. So we talked a little bit about this. I kind of got a little ahead of myself, but the airway management, putting the breathing tubes in, putting the chest tubes in, and interosseous access is where we can actually drill a like an IV, except it gets drilled into your bone. It's very fast, it's very effective, and then we don't have to waste time looking for an IV on you. We also, you see a bunch of this on ventilator management. So it's not, RTs, respiratory therapists, are especially trained in doing this. So it's certainly a little bit a learning experience for all of us coming from a nursing to learn how to use the ventilators like they do. But some patients, with the COVID patients that are out right now, or long-term patients, their lungs are very sick. So we have to think through the best way to ventilate someone like that. Someone that's having a child that's having an asthma attack needs to be ventilated differently than a healthy adult that was involved in a trauma needs to be ventilated. So being able to work through that and critically think through that is important. This is someone being intubated on the kind of outskirts of the half in and out of the helicopter right there. So sometimes you may be putting that breathing tube in on the side of the highway in a ditch. Sometimes you're in an ER and you're the most experienced person there that's doing that. Pretty cool. This is a chest tube that we talked about. So it's kind of a gruesome picture, but this goes directly into the lung and can drain blood out or air out that needs to be. And then ongoing training. So we are always practicing. Chest tubes is not something that I do every shift that I come in. So I need to practice that. So when that scenario does come up, I can do that proficiently. The other thing about airway management is to put a trach into someone. So you've seen the movies where people get intubated or they're choking or something like that. And so they have to cut the throat here to get air in. That is something that sometimes we have to do, and we have to be trained on how to do that. So when that scenario comes up, we don't second guess and we can do it quickly and proficiently. The ways that we practice are on a cadaver lab, which is, I guess, I don't know if you guys know what that means, but it's basically someone that's donated their body to science after they have passed away. And physicians and us are able to come in and do these procedures on is the next best thing to having a live patient. And it's very awesome that they do that and that we are able to get the hands-on skills like that.
I actually have the kids go to a cadaver lab, so they get a 4.5 hours experience in the lab.
Wonderful. Okay.
Unfortunately, we had to cancel this semester, but hopefully things will open it back up once vaccines and other things take place and I can get all my kids to the lab. But it's definitely one of the best experiences of these kids' high school career is they get to see, well, we usually see about 3 or 4 different cadavers. They have the whole specimen lab. So they have hearts, lungs, livers, spleens, they have a bucket of eyeballs, which the kids are going to kick out of. And, it's just kind of CU has been treating us really well with it. So it's been fun. So yes,
awesome.
They should know. Unfortunately, these kids haven't been to the cadaver yet, but usually I have it in the first couple weeks of the class. The kids get to go and they miss school and get to see a whole live experience of what it's like to deal with, work with the people who've donated their body to science. That's pretty cool. I'm sorry,
Yeah.
I didn't mean to interrupt. I apologize.
No, please do. Please stop me if you have anything to interject or that's great. That is super awesome that they get to do that. It's not the same as looking in an anatomy book. Um,
That is very true. So hands-on versus looking at a book are two different things.
for sure. When I was at Duke, we actually had a animal lab. So one of the first intubations where we put the breathing tube in was on a ferret. So it was supposed to simulate doing it on a baby, but you had to do it quickly because the ferret's metabolism is so fast that when they took the anesthesia gas off, if you weren't fast enough, it would bite your finger. So lots of learning opportunities. And then of course maintaining our certifications, equipment checkoffs. So even some of the equipment we use all the time, but some of the more advanced equipment that isn't needed on every single patient, we do quarterly checkoffs on that as well. So we are always training. We do get to do some fun training outside. So we do a survival day every year. I'm not entirely sure what they're doing here. I think she's trying to stay warm, maybe try to build a shelter and ignore that, please. But we have lots of fun. We learn how to start fires. We carry a survival bag with us. So if for some reason, not necessarily that the helicopter, I hate to say crash, but that we crash, but sometimes there can be something very dangerous in flight maintenance wise and where we need to get to the ground fast, or we might be somewhere where we don't have cell phones. It might be in the mountains. It might be very cold. Well, it might be a 70-degree day in Denver. As we know, the mountains can be much colder. So we carry warm gear with us, something to start a fire. Personally, I carry some food because I get hangry really fast. And snow gear, so lots of different things that we try to carry with us, so just in case that scenario happens. And there have been some situations where the helicopter has been stuck and it just takes a while for them to get someone out there to you. So hopefully it just doesn't happen when you have a patient on board. Okay, so kind of a little bit about what our daily life is like. I talked some about how we come in. So you'll meet your partner for your 24-hour shift. You are with that partner and the pilot for 24 hours. We do have separate rooms so we can have some time apart, but we cook dinners together. Like tonight I'm making chili for everybody. We're just like a big family. So we work day and night. So you might get a call at 3 a.m. That call goes off and it's like you're instantly in the moment, and you get up and you throw your suit on and you head out the door to whatever needs to be. Oh, and the cool thing about working at night though is that we get to use night vision goggles. I know, it's pretty cool. So we operate in good weather and bad weather. Obviously, if the weather's too bad, we can't fly in it, but we can still take the ambulance. If it's snowing, we can fly as long as it's not too bad, the clouds are high enough. There's a lot of different factors there. Rain, we can fly in some rain. I have flown over top of dust storms beneath us and flying out in Nebraska. Sometimes there'll be, when I flew in North Carolina, there were thunderstorms everywhere, and you could see on the radar and you would go fly right around these thunderstorms and just they'd be right outside your door. But because where we were, there was a scattered thunderstorm, there was no storm, and you would get around them and keep going. So we fly out east, which I talked some about, Kansas, Nebraska. Even though we're all based, well, most of it is based in Colorado, we can fly anywhere. All the way out west, our NEO team frequents going to Vail Hospital. So that's pretty cool. We work together, obviously. You always have your partner with you. Leave no man behind. Where's my partner at? That's your person for the day to bounce things off, to work together, I'm doing this, you're going to do this. We work with EMS and firemen and police and state patrol. We work with all the different agencies to come together. So usually either fire or EMS they get a call to a scene, and then either they on the way are like, this sounds like it's going to be really bad, let's go ahead and dispatch the helicopter. Or when they get there, they say, oh, we definitely need a helicopter for this, and then they'll call us in. Sometimes if it's something really bad, they go ahead and dispatch us, and we may beat them there, and so we're the first ones on scene to meet the patient. Fire is amazing by keeping the highways closed for us, the scene safe, getting the patient out of the vehicle. As you can see in this truck here, we have to wait until they can get the patient out for us to actually be able to work with them. And they block the highways off for us and keep us safe. So we work with other programs. So we do teaching, sharing each other's what we've learned, things like that. It's not just, I mean, yeah, there's pride, just like in your basketball teams or your football teams, I work for Air Life or I work for Flight for Life, but we really are all truly doing the same thing and the same job for the patient. We do community events as well. So coming to, so we do a annual run every year and different community things that we can help out with. And you truly don't know what the day will bring. There is no 2 days that are ever the same at this job. And you think that you know what you're doing and you think that you have things handled, and a curveball will come at you and you roll with it and you figure it out and you do the best that you can with the training and the knowledge that you have and the resources that you have. So I think we'll go through a couple more pictures. So this is probably Firestone where they do those hot air balloons out there. I keep asking the pilot to fly closer to him and kind of blow him away, but he won't do it. Challenges, cold weather. Sorry, I don't know what that's doing. Okay, questions, but you guys can't really ask questions because this isn't live, but
So what we'll do is there's a spot where the kids can type me a question.
Okay.
And send you an email.
Yeah, that'd be great. That would be great for sure. Is there anything that I didn't cover that you have questions about right now?
No, it was awesome. Well, I will tell you this. I grew up hot air ballooning. My dad had a hot air balloon from 1980 to 1990. And don't fly your helicopter close to them because that ripstop nylon is not gonna handle it. So
I just really want to get closer to see them, but they just probably just blow them away. So I thought, well, maybe that would be good. I mean, make them go faster. No.
have you ever flown in a hot air balloon?
I have not.
It's pretty cool. It's not, you don't cover the kind of ground y'all cover, but we definitely had a lot of fun doing it. And gosh, it's so long ago. I mean, 1990 was the last time I flew.
Wow, you should get back on it.
Yeah, I actually have my pilot's license. I just FAA says, well, I'd have to go back and look, but back in the day was after like 3 years of not doing it, I had to do a solo flight with 2 touch and goes. But it's just, I mean, everyone's commercial does it now. Back when I was in Arizona, it was like all these, it was like having a boat. I mean, people went out and did it. So it was fun. It was definitely a fun time. And
yeah.
And probably you guys probably deal with this as well. Like, really, you had to have an accident with all those power lines around, because every time we flew, it doesn't matter where you're flying, the wind dies right above the power lines. You're like, so
yeah.
But great job. I'm gonna go ahead and hit stop on the recording.